Good afternoon. My name is Shelley Kiley. I'm a registered nurse, and I'll be doing my capstone presentation on adolescent mental health. My case study is based on a clinic. It is Herman Pediatric Medical Clinic, and it is in the upper Middle West. It serves around 20,000 people, and of those 20,000 people, around 800 of them are farmers. The actual staff is 12 pediatric practitioners, 4 nurse practitioners, 15 RNs, 5 LPNs, and 2 telehealth nurses. The proposed grant is that we will be getting a higher rate of well child checkups, greater than 50%. Right now we're at 46%. And I am basing my study on Medicaid coverage. So Medicaid does report to the counties, and the actual organizations report to Medicaid. So this can be a well-structured and very valid way to determine how many people are receiving actual intervention before the age of 21. According to the Journal of American Medical Association, right now only 3 states out of the country are in the 80% for receiving any kind of early intervention. Approximately 4 out of 10 Medicaid beneficiaries younger than 21 did not receive any recommended screening, and that was in the fiscal year of 2017. So we definitely have a long ways to go. I would like to see 1 year. So in 1 year, I'd like to see us be above 50%. And the people that are in the stakeholders are going to be, of course, the patient, the teachers, counselors, peers, law enforcement, fathers, mothers, siblings, foster parents, social workers, nurses. So the primary stakeholders are going to be the patient, the family, the nurses, the nurse practitioners, the pediatric practitioners, the RNs, and the LPNs. The rest are important, but we're going to focus on educating our staff and our patients and the families. The more that we educate, I feel the more that we're going to have a better outcome and patient-centered care. So my policy that I want to implement is called Promotion of Adequate Adolescent Mental Health Care. The purpose is to demonstrate autonomy while providing consistent and quality care targeting adolescent age patients in need of mental health intervention, with a response of greater than 50% well child checkups being performed. The policy: all qualified providers working with adolescent age patients will provide with adequate education to promote understanding of mental health needs. This will foster the autonomy needed to help with patient-centered care. What I've noticed through my research is that there's just not a lot of education. According to the mental health screening for children and adolescents, pediatric nursing, Ivy had stated that a lot of the practitioners didn't feel comfortable taking care of mental health patients. That's a problem. We need to educate them so that way they do feel more comfortable and more confident, because there's not enough psychiatric interventions. We do need to have more of our practitioners and our registered nurses and our licensed practical nurses confident in doing well child checkups and seeing what's important and who needs to be having interventions, and making sure to have that communication and that connection. It really all comes back to education. So, procedures on my policy. Education, number 1. All qualified staff will have mandatory education provided by the institution. So Herman Pediatric Medical Group will be providing this education to all of their staff that are providing care with well child checks. An online education video with a quiz with a PHQ-9, a PHQ-3, and a well child mental health checkup assessment will be performed with a passing rate of greater than 80% or higher. So in order to work with these patients, you're going to have the education, and you're going to have to take the test and pass it with an 80%. On-site education with questions and answer sessions for the first 3 months will be available. If we need to do more than that, we will. But for the first 3 months, we're going to have a couple educators there that will be assessing and making sure the staff feel comfortable. So already we're in month 3 of this policy, and we're not able to implement it yet. We're still educating. That's why I'm saying give it a year. 2, if education is not completed by deadline, qualified staff will not be able to provide care during well child check examinations. That's very important because we need our staff to feel competent and safe and comfortable, so that way the patients feel comfortable. It's all about patient-centered care and family-centered care. B, education will be provided to patients and families during well child visits. So this is one of the most important things. If we don't explain to the families and the patients that they need to come in to be assessed, if there's any kind of changes in the child, any physical or emotional changes, who to contact. What if the doctor gives them medications? We need to make sure that that patient and the family knows what to be looking for. Suicide, that's a big one with medical intervention. Medication intervention really does have a high rate of suicide if we don't watch it closely. What kind of follow-up visits will be set up in the future? When they come in, they're a year old. We're going to have another well child checkup at 2, at 3, at 4. Be expecting this in the mail. Be expecting that. Be looking for this. Be looking for that. It's very, very important. Safety. Safety is so important. It's number 1 with mental health. We need to make sure that we provide them with non-emergency crisis hotlines and emergency numbers. C, showing support to the patient and family, providing information and informative conversations on mental health and the ability to grow. Sharing support groups in the community and through the clinic setting. That's going to be where we work with the case manager and the social worker. We want to make sure that we're all on the same page and we're helping each other. Establishing the right ways to contact the patient. Are they using MyChart? Do they want to be contacted by email? Do they want to be contacted by phone? How about accurate and up-to-date address? It's very important that we do that. Here's where we need to make sure that we're all on the same page with the case managers and social workers. We'll be reporting all of our clients that are being seen to Medicaid, because that's how we're going to know our numbers. It'll take about a year of learning and reporting to see what those numbers are. We want to foster a healthy relationship for congruent office visits, so that way people come back. That way people feel safe to come back. That way people feel comfortable. That's very important to us. So my recommended changes are that we have more education, something more in physical writing. And identifying the problems that we're having right now really is just intervention, knowing how to communicate, what to look for, and how to feel more confident and comfortable and self-aware of ourselves while we're assessing our patients. So I hope you enjoyed my presentation, and I hope you find yourself in a healthy and a happy day. Thank you.